guys, I'm here with Catherine to answer your frequently asked questions on our new skinny shot. One of the questions we get, where can I inject?
That's a really good question. Since the medication is a systemic medication, meaning it works throughout your body, it doesn't really matter where you inject it. Meaning that where you inject it isn't going to be where you lose the weight. So we usually recommend injecting anywhere where you can pinch, so kind of the abdomen, thighs, and back of the arms.
Okay, cool.
All right, another question we get is how long patients have to be on the medication.
So all the original studies had people on this anywhere from 42 to 72 months or weeks, so a year roughly. But there's some newer studies coming out where patients on it for as low as 20 months. So right now we're telling people the best bet is to follow the evidence and stick with it for about 5 to 6 months. So that way your results are consistent.
All right, another question we get is if patients' medications interact with the semaglutide or the skinny shot.
Yeah, great question. So there's only a couple medications that we really worry about. One is birth control. Unfortunately, because this medication works on your intestines, we think that it can change the way that birth control is absorbed, and so it might make it less effective. So patients that are on oral birth control, we recommend doing something different, either barrier or an alternative birth control method. The other medications class we worry about are medicines for diabetics that lower your blood sugar. Sometimes people are on these for other reasons than diabetes. And so we like for patients to stop those because we want their blood sugars to bottom out, and that can be a dangerous situation. So in general, most medicines are okay, but we do worry about those two things. Some of our patients are wondering, can I take this before surgery? What do you tell them?
Yeah, it's a really good question, especially because a lot of weight loss patients do take the medication in preparation for surgery. And what we usually tell them is we want their weight to be stable for at least 2 to 3 months before the surgery. So that means we would want them to ideally start the weight loss shot, the skinny shot, at least 6 months to 12 months in advance. And then they can stay on the medication as long as their weight is stable throughout the surgery as well.
Right, you can still see some pounds dropping, but really this is to help make sure that your body's still able to heal from the surgery. So sometimes if we're doing total body transformation, that's a lot of areas for your body to heal. So I want to make sure you're able to take in protein and not really dropping the pounds just yet. And we also want you at a stable weight so we know exactly what to do during our surgery to make you look your best.
Yeah. All right, another question we get from patients that just recently had a BBL, how the weight loss shot will affect them.
Yeah, so in general, the weight loss shot helps you lose weight. So you can see your results decrease in size. However, the nice thing is that this is a proportional weight loss. So if your booty's getting smaller, that means your waist is also getting smaller. So the relative shape and proportion will stay about the same.
All right, another question we get is how much weight we can lose on the shot.
Yeah, so the best things we can do is follow what studies have been done. And the studies have shown people lose on average 15% of their body weight, which correlates or translates to about 30 to 35 pounds. Now those are people that have been on it for a year. And these are also people that have diabetes and are generally have other comorbidities. What does that mean for you? Well, the weight loss is not necessarily going to stop there. I've seen several patients who have lost 80, 100 pounds, even more. And because really what works, these help you institute some lifestyle changes, dietary changes, become a little bit more active because you're shredding the pounds, get more motivated. So really the sky's the limit for how much people can lose. All right, so another question people ask, and it's a little bit of a strange one, but will this medicine make me lose my hair?
Yeah, we have had some patients come in and there hasn't been any hair loss shown in the studies, but we will say that dramatic weight loss without the proper nutrition can cause some hair loss. But we do tell our patients in the visit, even though your appetite and cravings will be reduced, we still want you to eat a nutrient-rich diet and still get those vitamins and minerals and even take a multivitamin.
Another question people have been wondering is how often do I have to come in? Since they get the medicine from us, what do you tell our patients?
Yeah, so we have them come in for their consult, we give them their first months of medication, and then we have them follow up every 3 or 4 weeks. And at that time we can kind of manage their dose to see if we should increase their medication, keep them on the same dose, and then kind of go from there.
That's right. We're looking at side effects that you may be experiencing from the medicine, looking at the weight loss you've had. So once we hit our target, we know we can start to level off on the dose, or if we want to make any other changes. Thanks for hanging with us today to answer for the Hey guys, thanks for hanging with us today. If you have any other questions, hit us up in the DMs. We'd love to hear from you, know what questions are burning in your minds, and come in and see us so we can tell you a little bit more if you want to get to know if this is the right choice for you.
Right.